As the Topeka Community Foundation saw the data around health in our community and learned more about the social determinants of health, we were compelled to change our grant making to make the kind of difference that we all wanted to make in our community for our neighbors who need our help the most. We shifted our look from transactional grant making to what we called transformational grant making and asked our nonprofit partners to look at issues of importance in our community with a broader lens, to look upstream around the health of our community and to think about things not only as health as it walked into the door, but what was happening at home and how could we have an impact around that. Link came to us with this innovative idea around partnering in a way that had never been tried in our community before. What would it look like if we looked at patients who came to Stormont Vale and assisted them not only inside of our doors, but at home where they needed help the most? And that partnership has created a new system for addressing health in our community. That is what we want to focus on. What are the systems? What are the policies? What can we do in our community to really move the needle around health for our neighbors who need our help the most?
The LINK program starts with a patient from Stormont Vale. That patient from Stormont Vale will be identified as someone who would be eligible for health access. So to be eligible for health access, you must live in Shawnee County, you must live under 150% of the federal poverty guidelines, and if you do not have a primary care provider in Shawnee County, we help get the patient connected with primary care. Once you are identified and enrolled in health access, then we send that patient on over to the Stormont Vale social work team, and the social work team will screen that patient for eligibility for LINK. To qualify for LINK, patients must meet 2 of 3 metrics. They will be homeless, they have a rising risk score for readmission to the hospital, or they are food insecure. So if they meet 2 of those 3 metrics, then they are identified as someone eligible for LINK, and then the social worker will do a warm handoff over to Vallejo, the support navigator, for some intense case management.
The LINK program has paid for my medication on several occasions. My father got ill, I quit my job so I could be a caregiver, and he ended up passing away quite quickly, which threw me into being homeless and struggling on that, living in friends' houses or in my car. Then I fell into addiction. And when I hit rock bottom and became dangerous to be on the streets or living in my car, I got connected to Vallejo, and they had a good support system, and I had some medical issues that were real prevalent, and they took me to the mobile clinic on 6th Street in Topeka, and I won't forget it, and met a very wonderful nurse there that really listened to what my medical issues were, and she made a great observation that it was more serious because my addiction was covering up my pain. And so she made appointments with Stormont Vale, and there the ball got rolling, and we found out it was serious. So there they connected me with health access. So without that, I probably would have lost my life.
When we hear the stories, when we see the impact that this new model of care has had in our community, we can't help but feel compelled to ensure that programs and ideas like this continue to be funded and that we continue to make the kind of difference that we want to make for those in our community who need our help the most.